that strike by Nehawu members. Police are monitoring the situation outside Gray's Hospital in Pietermaritzburg. Nehawu workers have blocked the facility's entrance as part of their protest action over salaries. Well, let's get reaction now, and we speak to the MEC of Health in KwaZulu-Natal, Nomagugu. Simelane, MEC, good morning to you, and thank you very much for your time. Before we kick off this conversation, a very serious accusation has been made by the Regional Secretary of Nehawu in KZN, Ngubane. I just want us to have a listen first to what he had to tell our reporter just moments ago.
Some of the MECs in this province, they are around here. There's a by-election here in Ward 25. They are here, actually, just behind the hospital where the voting is taking place. But they don't care. Even the MEC of Health, they have been informed that she's around here, but they don't care. People now are dying.
MEC, that's Ngubane. Were you at all in the vicinity of Pietermaritzburg, near the Gray Hospital this morning?
Good morning, Polly. Let me start with that statement, but don't end there, because the regional secretary, the politician, he can make such statements and get away with it. I must say I'm very perturbed that you yourselves as a institution decided to actually continue with that narrative without actually speaking to me and finding out my whereabouts. So it does deal with your credibility, Polly. I must be able to say that.
Well, let me say this to you, MEC. MEC, let me pick up on that quickly, because we can't move on from this, and you are making it our issue that a leader of the unions or union members that are striking outside a hospital, and you're saying that we are the ones that have made the allegation. We simply ask questions, and the reporter, in my last interaction with her, she said she did try to contact the MEC or the health officials, and no person picked up a phone. I wonder if you were among those that did not pick up.
Let me actually, because I was watching you and her, Polly, she said she called the MEC and she called the MEC staff. I do not have a phone call from that particular journalist. Neither did I get a phone call from your studio until I called in, because I was listening to the conversation. So when I say what I'm saying, I actually was listening to the conversation.
Yeah.
It actually is quite sad that she stated it as a fact that she called me when she did not.
Well, this is part of what we do, MEC, and that is to give rights of reply, and that's exactly what we are doing now. Your response to that particular, your response to the particular accusation by the Nehawu secretary. So yours is, you are nowhere near Pietermaritzburg as we speak. No.
This is the right that I demanded, Polly, because after I listened to that, I called in. Having said that, I live in that area. So every morning I would leave from that area and come back in the evening. However, I am not in Pietermaritzburg today. We have challenges in the whole province. We have challenges in Pietermaritzburg. We have challenges in eThekwini. We have challenges as far as Mangus. So there are more than 70 hospitals that are affected by this strike in particular. The challenges in Grace did not start today. They started yesterday. The reason why you see that there are police men who are there today is because in the evening we had a meeting and we had a discussion with the provincial commissioner, and we were able to actually agree on a plan of action. But yesterday we had challenges in Prince Mshieni, we had challenges in King Edward, we had challenges Wamashu and Idlanda CHC. Because we engaged with the police and the eThekwini Metro, those have been brought under control to a certain extent. But there are other facilities that are being challenged as well. So it's not possible to have one person who is Nomagugu Simelane just to be in Grace Hospital when you have more than 70 hospitals to deal with. With that said, we are attending to the matters, and no, I am not in any by-election. Of course, there are by-elections that are being run all over the province, not just just in Mkungundlovu. There are 2 by-elections in Mkungundlovu, one that is there, the other one is in Watu. There's a by-election that is happening in Uku district, and there's quite a few others. So yes, ordinarily I would have been deployed in one of those, but I am working right now because the Department of Health is under pressure.
Let's talk about the interventions then, MEC. The reporter outside Gray's Hospital has been saying throughout the morning that what she's being told is that there isn't even skeleton staff at that hospital to assist with the patients. What is the situation in that hospital?
The situation in Grace, and I'm not sure why we are only focusing on Grace because there's quite a few others, but the situation in Grace and a couple of other facilities is quite a challenge because there are staff members who are caught inside, could not leave in the morning after their night duty was off. There are staff members who are outside who could not go inside because they have not been allowed to come in by the different people who are actually on strike. We have tried to work on a number of different strategies, including different ways of how do we get staffers or staff members inside the facility. We have succeeded to a certain extent. I will not be able to say it here because then it will conscientize those that are standing at the gate on how we got the staff members inside. However, we are operating on a skeleton staff and we are utilizing some of the night duty staff, yes, and we are very appreciative to those that are inside the facility and are willing to continue to do the work.
Just moments ago, MEC, we saw, and I'm hoping that this footage will be actually available. Firstly, there's a live picture right now of a fire that has been set up right in front of the entrance of the hospital. But what is also concerning is that people who appeared to be health workers, in fact, wearing gear that looks to be that of health workers, they were trying to enter that hospital. A striking member was wielding a stick and actually pointing it at them. It prompts the question, MEC, whether you are aware of any deaths that may have occurred since this strike started inside these facilities. And I take on board what you are saying, that it's not only Gray Hospital that has been affected, there are others. It's just that we are stationed there at the moment.
It is very unfortunate that you have health workers who made an oath to protect lives of the people, but are the very same people right now who have decided that they are going to stop their fellow co-workers from saving those lives. I must also indicate that health workers are very much aware that they are an essential service, and therefore when there is such a strike, they actually should not be affected and they should continue with the work and allow their union to represent them in the different negotiations. So you are talking about a fire that is there today. There was a fire here yesterday, most of the day. In the evening, I went to Gray's Hospital and there was still a fire. Hence, we had that engagement with the SAPS to get them to intervene, because we do have security personnel as a Department of Health, but though the personnel is actually manning the gates and making sure that the gates are not closed. However, the strikers are just outside the gates, and where they are is not necessarily a property of the Department of Health. Therefore, our security personnel cannot intervene. Hence, we requested the SAPS to come in. So we are hoping that the SAPS is going to be able to intervene and clear that particular hospital. It's very unfortunate that there are people who have decided to target that hospital, because Gray's Hospital is a specialist hospital and it's a referral point for many of the hospitals in the province. There are people who travel about 400 kilometers on a daily basis just to get there and get treated. So when they are unable to get inside the facility, it really means that their health rights are being affected. And that's what we are calling the union to be aware of and to be conscious of the fact that they actually have a responsibility to save their lives. Responding to your question on whether there are any deaths inside that have occurred as a result of the strike, right now we've not been, we don't have any report that speaks to such, we will be able to, sometime in the evening, to get into our reports or our different units reports and see how we have fed. But I must say, like I indicated earlier, Polly, we do have staff that is inside. Of course, it is skeleton staff, and they are quite exhausted.
Yeah. MEC, not only are health workers an essential staff in South Africa or are an essential service, but they are striking illegally because this strike has been interdicted. Surely there's got to be more than you can do to try and put a stop to this, because the strike is illegal.
Sorry, Paul. You are correct. The strike is illegal, and as a result, at the Department of Health yesterday or last night, we also got our own. Sorry, I'm having a serious cough.
All right, let me try and see if I can help you try and regain some strength. Hopefully, the MEC will join us in a moment while we allow her to clear her throat. But as you can see right now, these are visuals that we are beaming to you. That has been the situation outside the Grey's Hospital in Pietermaritzburg, and I'm trying to get the team to actually take the viewers or bring back the footage that we saw a little earlier, where some of these workers were actually literally threatening the health workers who were trying to enter that facility, because that's one of the key concerns that people like MEC Simelane should be concerned about. MEC, I hope you have gathered your strength. Let's go back to that question. All right, thanks, MEC. Let's go back to that question about the strike, not only, or these workers, not only being an essential service, which means that by law they are prohibited from striking, but add to that the fact that the strike is illegal, at least for now. A court of law has said you can't go ahead with this strike. So surely there's got to be more that you can do, particularly, MEC, if deaths do occur as a result of this illegal strike action.
Definitely, you are correct. In fact, there are now 2 interdicts that were applied for by DPSA. And the union in the province particularly decided to ignore that, and they went above that. We initially didn't have a problem with, we thought that the National Department will be able to manage it on Monday. But yesterday, when we realized that it looked like things were getting out of hand as a province, we then went and obtained our own interdict in the eThekwini area, because that's where the biggest challenges were yesterday. But it looks like now they have migrated to Nomagugu. So what we are discussing as a department is to ensure that maybe we need to then have an interdict that covers the whole province, not just the affected areas. We are working on that. We are consulting with lawyers right now. But like I said, the situation in eThekwini, while it is also a bit troublesome, but it is not bad as it was yesterday. And we did get an interdict to address the situation there. So we are looking at the same approach in Nomagugu.
Yeah. Perhaps a quite a straightforward question. Are people going to be fired for engaging in an illegal strike?
Well, the principle is a work without pay. That is a guidance that we received from DPSA. However, we will have to look at the individual actions of individual members within the Department of Health. I'll give you an example. There are members of a union in eThekwini, CHC, who actively stopped and threatened some of their colleagues not to come into their facility and not to help patients. In fact, they went a step further to actually stop patients from coming into the facility. They didn't stop there. They went to a nearer their sister facility, which is in under CHC, and tried to do the same thing. Fortunately, the management in that facility was very firm and was able to put them out. So such actions and such behavior will have to be dealt with individually, and every member will have to account for their actions. And if it takes us there, after we've done the investigations thoroughly, then that's what we're going to do.
MEC, as you talk about this kind of intimidation, that footage is actually on air as we speak to you right now. You can see clearly a member. You can see that footage. I'm glad you're able to see it, MEC. And the beauty about it is that visuals do not lie. That striker, easily identifiable. When you say these people will be dealt with on an individual basis, there is your first culprit. What is going to happen?
Like I said, these are labor matters. You behave in a particular manner, consequences are going to be meted out. We are going to mete out consequences on everyone who has contradicted, firstly the interdict, but everyone who has stopped and interfered with the rights of a patient and the rights of another worker. We will work on it, and as soon as we've dealt with that process, you will be the first ones to know. But rest assured, they are not going to go unnoticed.
All right, MEC, as we wrap our conversation, we do take to heart what we do at this station, and I've got to tell you that how we started this conversation is of serious importance to us, and that's why I'm going to, again, go back to this issue that our producer contacted your spokesperson, Simelane, trying to find you because they could not get a hold of you on the phone. Our reporter on the other end as well tried to get a hold of you, and they were trying to also get a hold of the HOD, and we obviously could not find you. But all I'm going to say to you, MEC, is that we take our job very seriously so that we don't take information to air that is not credible and double-checked. So please, let's try and be fair to one another when we come on air the next time around, because my suspicion is that you have since been called by your spokesperson to then demand a right of reply. Or is it the other way around?
No,
you insist.
No, it's not. I was actually watching when you and your journalist were talking. When your journalist explicitly said she called me. She does not have my number. She has not called me. I called the station and demanded to be heard. I think we must. I'm going to be very firm on that, because you did not call me. Your journalist did not call me. I only got called when I made the calls. No spokesperson, even my people were not even aware of this interview, because I'm the only one who was watching TV when I listened to it.
All right, and so you were able to get a hold of the station.
Personally, I was not called, and you said you called me.
Yeah, so how is it that you came on air in the first place then?
I called in. I called into the station, I called into your producers, and they then gave me a number that has not been used in more than 7 years.
MEC,
but insisted that they called me.
All right. MEC, let's leave it there, but thank you very much for your time. And again, let me thank you for your time. And that's the MEC of Health in KZN. And more important matters is that the person who has been caught on camera threatening health workers who were trying to enter that hospital, she could say during this interview that she was able to identify that person. Hopefully, we are going to get some answers from her, and we are going to continue this conversation along with others. In a moment, we're going to speak to Mbaza Mashilowa.